So in looking first at our working hypothesis, we would kind of note that we're pretty favorable now for shoulder pain with power and strength deficits in the nature of a biceps and rotator cuff tendinopathy. This is kind of identified by that positive Hawkins-Kennedy sign, as well as painful arc and resisted external rotation. A large study back in 2005 by Park et al. Identified if there's 3 of these positive, the likelihood ratio is almost 11, which is quite significant, and kind of in noting that there's a pathology of the biceps tendon and rotator cuff. Not too far behind, but not quite as likelihood, since he didn't have a drop arm sign. He does have pain with resisted external rotation as well as that painful arc. Only about a 3.5 point shift. And like I said, he didn't have all 3 negatives, so we can't really rule it out at this point. But given the fact that he's rather functional, the odds of a rotator cuff tear that could potentially be rehabbed positively is still unlikely for a tear, but positive in terms of a rehab process. And then that AC joint arthrosis, when we look at some of the tests to help rule out that, we see that if there's a negative cross adduction test, no tenderness of the AC joint, and a negative Paxinos/compression test, that we're pretty confident in kind of ruling it out. He didn't have a lot of things to rule it in, and so pretty comfortable ruling out the AC joint. And then, like I said, everything's kind of pointing towards that subacromial tissues, and likely more of a tendinopathy at this time. So along those same lines, now let's take a look at, based off of your exam findings, how would you kind of shape the impairment distribution? What percentage would you say is due to cognition and beliefs, motor control, or mobility, including predominantly soft tissue and or joint?